So when patient comes in, they always tell me their story, and I always ask them, so tell me, what was your first symptom? Well, interestingly enough, most of the time patients find a lump in their breast, and then they go get imaging. So the imaging we normally use is mammogram and ultrasound and MRI. I usually will add thermography to that regime. So we want to understand everything about the anatomy of what's going on to make sure that it's just in the breast, it's just a lump in the breast, and it's not in the lymph glands or somewhere else in the body. So it's very important to understand our imaging and do the proper imaging to understand the scope of the illness. Then I order a very elaborate panoramic lab test. So I will do a chemistry, a CBC, a thyroid, a hemoglobin A1C, which checks your blood sugar over 90 days, inflammation, CRP, vitamin D levels. I do something called D-dimer. D-dimer tells me if the cancer is on the move or you have a tendency to clot. I will do all the hormone levels, estradiol, total estrogen, progesterone. I also will do prolactin, because prolactin can make a cancer more aggressive. Then I always check someone's Nagalase. Nagalase is the enzyme that poisons the macrophage, preventing them from attacking the cancer. I also will check a PHI. A PHI is the enzyme of hypoxia. Hypoxia is low oxygen. The other thing is I want to understand all the nutrient values. So I will order a blood test that is fasting blood and urine that checks vitamins, minerals, omegas, toxicity, gut balance, antioxidants, heavy metals, and minerals in the body. Then I will I have all the patients do emotional workup, because just being diagnosed with cancer is very traumatic and dramatic for every single person. So we have really ascertained that patients can't heal in a stressed state. So I believe that every patient should start out with some kind of emotional therapy, and in our clinic we use something called EVOX. EVOX is using your voice to reprogram emotional conflicts. There is usually a stress component in most diseases, and so if we don't address that, the body can't be allowed to heal. Then I will ask the patient, how is your sleep? You've got to sleep 8 hours every single night. I tell people bedtime should be between 10 and 6, but about 50% of the population doesn't sleep. So then I will create the best regime for them to help them sleep. Then they need to drink proper water for hydration, because most people are not drinking enough water. Then I'll go over their eating, because we've got to get off sugar and carbohydrates and junk food and things that really don't help the body heal. Then I want to make sure the patient is moving and utilizing their 800 muscles, getting proper sunlight. And then I always will put every patient on some kind of detox plan. So I have them do liver cleanses, either through a coffee enema or a liver flush. I will have them do a detox bath, which is Epsom salts and baking soda and clay. Then I will have them take something orally to detox. I always have my patients take vitamin C. Vitamin C is very, very important for every cell in the body, and it's very anti-cancer and tremendously helps the immune system. Now, one other thing that I use is pancreatic enzymes. Pancreatic enzymes strip the coating of the fibrin coating of cancer cells. Cancer cells coat themselves in 15 layers of fibrin. And so then fibrin is normally found in the body, so the immune system doesn't recognize it because it's nicely coated in fibrin. So these pancreatic enzymes strip the coating of the cancer cells, so the pancreatic enzymes can reveal the cancer cell to the body. So that is just the beginning of of how we would work up a breast cancer patient. And so, again, breast cancer, just like other cancers, require a complete elucidation of everything of the foundation of how the body works. It's not something simple that we can just kind of say, okay, here you have this cancer and we cut it out, or we do chemotherapy, or we do radiation. Yes, you may need one of those three things depending on your particular situation. And so, but we want to educate you on everything, on how the body works, so you truly understand how you can take care of yourself.